So here we are with the last segment for chapter 6, indications and contraindications, in our fundamentals of therapeutic massage textbook. And I want to remind you that content presented in this textbook or in this chapter is supported by your essential science studies. And chapter 2 in essential science is specific to mechanisms of health and disease. So you're going to want to work back and forth. And the YouTube list that I have set up to accompany the science studies is very helpful in expanding this information. So let's share our little screen. I think I've sorted out how to do this. I'm sure there's a better way, but so the idea here in this segment is how to avoid harm and how to make decisions to do that. So there is some fundamental language in order for us to understand this, and we do need to also know how to use resources. So the Medline Plus website, which I refer to a lot, is a really, really good beginning source to explore information to help us make decisions about contraindications. It's really, really, really important as we are working with clients to know what not to do and when not to work. A lot of people focus on what to do, and that's important too, but just as important is what not to do and when not to do something. So you read through your section objectives. This is the overarching objective of the chapter. Here are the objectives we're taking a look at in this segment. And do stop and read the mentoring tips and review the language we talked about earlier about indications and contraindications. Then we're going to try to get a handle on this idea of caution. So caution is when we slow down and research more, and then that will lead to an adaptation. Most every client can receive benefit of massage if they want, if we know how to function with caution. So one of the things that is an indication that we may have to alter what we do is if somebody is taking a medication. And if you go on Medline Plus, they have all the medications listed, and you can click on that and you can read what it's for, and you can how it fits in with a treatment for a particular condition. And pay attention to the side effects. Maybe in certain circumstances, massage can help reduce some of the side effects so the person is able to get the most benefit out of the medication. And sometimes it might interfere with our ability to give a massage. Some medications will cause a rash, for example, or they might really upset somebody's stomach and they don't feel well enough to get a massage. And then we have medical emergencies, and this is where we need to be aware and respond quickly. So these are described here. We have deep vein thrombosis, stroke, concussion, heart attack, sepsis, allergic reaction, diabetic emergencies, rhabdomyolysis. I worded that one, didn't I? And we also have areas where the structure is more vulnerable. This is usually because there's less padding around it. It's where structures such as a vessel or a nerve or a node is close to the surface, so that if we apply a lot of pressure in the area, we could, the compressive force could be uncomfortable or even cause some tissue damage in the area. So that's what endangerment sites are. And then we really need to know about how do we refer. So if we're going through this and we are concerned, something niggles at us, we think, because in the beginning, a lot of pathological symptoms are very vague. Fatigue, some changes in digestive function, changes in sleep, on and off fever, pain that's more deep and achy, that you can't put your finger on what it is, and that's a need for a referral to see if some other medical tests like blood work and a thorough exam by a medical professional could potentially find what's starting to break down. And it can be reversed more quickly. So early diagnosis is an issue, and if there is a concern by other medical professionals, it is that because massage can help people feel better for a little while, that it's going to delay them getting early diagnosis when conditions can be treated. And there are other health professionals that can function in the disease process, like naturopaths and chiropractors, but they are also trained, highly trained, to identify when this could be a medical condition that needs to be diagnosed and treated using medical science. And that's a good thing that we have that. So that's an important factor in the idea of indications and contraindications. That less is more here. If you are unsure, you may want to move into a palliative approach with the client that day. And you can avoid areas. And then sometimes when you become cautious, which is going to have you adapt your massage, and we're seeking outside information, the client may resist that referral. And that becomes an ethical dilemma then at that point. Do we continue to work with them even though we continue to have this idea that something more seriously could be wrong? I mean, we could dismiss them and say, if you don't get these, if you don't go to your doctor and get this checked out, I'm not going to work with you. We can do that. But if they feel comfortable and safe with us, then we become a health professional that can maybe continue to encourage them to get this looked at and treated if needed. Things like diabetes and thyroid dysfunction and cancers, some of their initial subtle signs, if you can figure out what it is, they certainly can be treated effectively. And then other health supportive therapeutic procedures can help them along with that. So just make sure that you document. And you continue to operate with caution in those difficult situations. Medications are easier. And by using Medline Plus, you can easily look up what's going on. And you can use other sites too with this. In general, with a medication, it's going to try to get the body to do something that it's not doing very well on its own, or it's going to try to limit something that the body is doing too much of, or it's going to replace something. So I take thyroid. My thyroid function diminished quite a few years ago. And it appears to be an autoimmune type response, not necessarily an autoimmune disease, but an inflammatory issue. And so I have taken thyroid replacement medication for a long time, and I'm thrilled that that's available. And that dose has to be monitored, and just recently it was increased a little bit, and I feel much better. And so I'm glad that my physician was able to detect that and make that adjustment. So in general, that's what these do. I also take aspirin related to my cardiovascular conditions, and it inhibits a process. It inhibits coagulation. It's an anticoagulant. It's also a little bit of an anti-inflammatory. So it works with that underlying situation I might have with inflammation, as well as the tendency to clog up in my arteries. And then I also take for an anxiety type condition, some OCD, obsessive compulsive behaviors. I also take a serotonin reuptake inhibitor. I take Zoloft, and that stimulates a body process that encourages serotonin to stay, which helps with some of those anxiety tendencies. It encourages the body to keep the serotonin a little more active, and helps me function without some of the repetitive behaviors. So that's an example of how these medications can work. Now, the aspirin, sometimes I bleed a little bit, and sometimes I get some gastrointestinal discomfort. The thyroid, I don't notice too many symptoms or side effects with that. And it was interesting when they upped the dose for me with the thyroid, though, that I did for a couple of weeks while my body adapted to it. I did have some side effects. The one I noticed the most is that I was really hot and I sweat a lot, which is not a typical thing for me. But I understood that that was part of adapting to that new medication. So, I'm trying to pause. So, this idea of medical emergency, this is when you would take action quickly. Uh, whether that is an immediate, insistent referral to the emergency room, or it's calling 911. If you are calling 911, make sure that the environment is set up so that the first responders can easily get to the client. So you can move, if you can quickly clear the pathway, that's a good thing to do. And then you just kind of hold down the fort for a few minutes until they get there. The ones that are going to be more 911 involved would be stroke. And if concussion, regardless if they've lost consciousness or not, it can be very serious. So depending on what's going on with this could be an insistent referral, or it could be a 911. Heart attack, certainly suspicion of a heart attack would be potential consideration for a 911. Sepsis is very life-threatening, and it can happen quickly, but it's hard to tell what it is. It's an overreaction of the immune system. People can just feel very unwell, and then all of a sudden their whole body adaptive capacity is overwhelmed. So again, whether or not this would be a 911 or an insistent referral to the emergency room, this is a serious condition. Anaphylaxis, an allergic reaction, that's life-threatening. And so sometimes clients will have conditions and they will carry medication with them. And you should know how to use the emergency medication on how to interfere with this, and then 911. Seizures too kind of become an issue in through here. If a person's prone to seizure, then they should be telling you that and what to do. And that may determine whether or not you can manage it or the severity of it on whether you need to call 911. So you'd want to have that discussion. And then diabetic emergencies, this is blood sugar issues, and the person can be dizzy and fainting. A lot of times people know how to self-regulate this, but it also might sneak up on them. And so again, depending on the severity of what's going on, along with an altered mental state, would determine whether or not this is a 911 call or a referral. Rhabdomyolysis is where there's a breakdown in the tissue. Massage therapists are not as familiar with this. It usually occurs in a crush type injury, but we're seeing more and more of it if there has been very, very aggressive exercise. And the body just can't recover from that. There's even been indication that people that have had too aggressive of a massage and they're very sore the next couple of days, that this has been a factor of what's caused that. But it too can go to a very serious condition quite quickly. So be aware of your medical emergencies and understand, be prepared that you may find yourself in a situation where you're going to have to deal with this. And this is why it's important that all massage therapists have their first aid and they keep that current. And then, you know, these endangerment sites, you know, most of these make a lot of sense. So just, you know, modulate your pressure and everything should be fine on that. So this is taking us out. Make sure you do these professional proficiency exercises. This is how you're going to, a little practice on referral here. It's a nice role play kind of a thing. Maybe even a chat. You know, our medical professionals are really busy, but they also want to feel confident in referring their clients to massage therapy. So maybe you can have a discussion with a local healthcare medical care provider. So I am obviously getting some noise from the outside. So we're going to wrap this up. And you know how to do this with the factual recall questions as well as the more complex ones as we get down through here and continue to practice writing your own questions. Okay, this completes chapter 6. And as we move into our next chapter, we're going to be dealing with safety, sanitation, all of that, which is particularly important that we understand all of the behaviors and accommodations that we need to make for a safe environment for us as well as for our clients. Okay.